So let's continue for single best answers from Love and Belly. Question number 161. A 22-year-old man is brought into emergency department following a road traffic accident. He sustained open fracture of right tibia and fibula. Heart rate is around 110 beats per minute. Blood pressure is 105. Respiration rate is 28. Urine output is 30 ml. So this is about a person. What is the type of shock? 1, 2, 3, 4. There are 5 classes of shock. He has got open fracture, means he has lost the blood. Heart rate is 110. Blood pressure is 108 and 85. Respiratory rate is this much. Urine output is 30 ml. So till class 1 and 2, heart rate doesn't changes a lot and blood pressure is still okay. So advanced life trauma support classification of hemorrhage is based on percentage of acute blood loss. Class 1 hemorrhage is around it is about 15%, less than 750. This is 750. Class 1 hemorrhage is less than 15%. There may be mild increase in rate but no physiological changes. It is exemplified by a condition of person who has given 1 unit. It's just like a person who is donating 1 point of blood, 1 unit of blood. It's equal to class 1 blood loss. Class 2 is around 15. This is around 15%. If person is losing 15 to 30%, is class 2. And again it is around 1500 ml, 750 to 1500 ml. So what happens? There is till this class 2 hemorrhage, circulating blood volume is lost. There is tachypnea. So respiratory rate, if it goes between 20 to 30, it will be, here it is 28. And tachycardia, heart rate is going above 100. Then blood pressure is, and urine output, which has to be around more than 30 ml. It should be more than 40 ml in class 1. In class 2 it is around 30 ml. So not much changes. So blood pressure normal. So till class 2 the heart rate goes above 100. In class 1 it has to be less than 100. So heart rate is here. In class 3 it is more than 120. Class 4 is 140. So 1, 2, 3, 4. So class 5 is actually not there. Urine output is generally more than 30 ml. Here urine is just 30 ml. It should be more than in class 1. So this person is fitting in class 2 type of hemorrhage. Why not class 3? Because it has to be, urine output has to be same, but blood pulse rate has to be above 120. Here it is 108, 110, and blood pressure should be more on lower side than this. So this can. Coming to next question. Concerning pulse oximetry, it measures oxygen partial pressure. Reading are inaccurate in presence of carbon monoxide. It gives good indication of ventilation. Reading are usually reliable despite poor peripheral perfusion. It usually uses 3 wavelengths of light. So reading are inaccurate in presence of carbon monoxide poisoning. This is right because it measures partial pressure of oxygen. It doesn't measure partial pressure, it is just oxygen saturation. Pulse oximetry measures oxygen saturation, not it is measuring oxygen saturation. Then the readings are inaccurate when there is carbon monoxide poisoning. What happens? It uses two wavelengths, red and infrared, and calculate the difference of absorption of light by oxyhemoglobin and deoxyhemoglobin. Oxygen saturation is then calculated from the data. Only pulsation component of the arterial blood is measured and constant background skin and venous blood is used. However, it has several drawbacks. It does not give good indication of ventilation, reflection, partial pressure of carbon dioxide, and presence of carbon monoxide. Pulse oximeter readings are unreliable. So carbon monoxide competes with oxygen binding to hemoglobin, forming carboxyhemoglobin, which also appears bright red and gives falsely high saturation. So carbon monoxide may give high saturation because it's just like oxygen competing and giving bright light. It depends upon the light. It gives good indication of ventilation. This is not true. Ventilation is no related. And despite readings are usually reliable despite poor peripheral perfusion. When there is peripheral perfusion is low, readings cannot be reliable. And it gives 3 wavelengths of light. No, it gives 2 wavelengths. Okay. Coming to next question concerning the course of phrenic nerve. So phrenic nerve, it doesn't arise from the posterior cervical rami. Between phrenic nerve courses, so how is the phrenic nerve arises from? It has anterior. This is anterior cervical rami. It travels anterior to vagus nerve. This is correct. Vagus is posterior, it is anterior at the level of hilum. It passes between medius and scalene anterior and lateral, which courses on the neck, and right and left phrenic nerve travel anterior to vagus nerve bilaterally. The right passes through the central tendon of the diaphragm. The right actually passes inferiorly lateral to superior vena cava and into fibrous pericardium overlying the right atrium. It travels anterior to root of lung and pierces caval orifice of diaphragm T3. So it doesn't pass through the central atrium. It passes. It runs on scalenus medius in the neck. It runs on scalenus in between medius and anterior and lateral. It courses in the neck. Actually, it comes in front of scalenus anterior. The left branch courses posterior to left pulmonary trunk in the mediastinum. The left phrenic nerve crosses arch of aorta, not the pulmonary trunk. Here it has to be arch of aorta and courses inferiorly anterior to left pulmonary artery and fibrous pericardium. After crossing the root of lung, passes through the central tendon. This is passing through central tendon. The right is thus passing through central tendon. A mother notices that her newborn baby is drooling excessive on feeding him. He swallows normally, but moments later starts cough and appears to choke, which is brought up through his nose. Which of the following is most likely diagnosis? Now, what's the person? The baby is ingesting, means taking the feeds, and after swallowing, later he starts cough. So there has the commonest is atresia of the esophagus. There is no tracheoesophageal fistula in the option. So esophageal atresia is most of the time affected along with the, which results in esophagus ending in the blight. Only 10% of the student with congenital phlegm, the 2/3 of the bone. Duodenal atresia should have bilious vomiting, small bowel atresia, distension, gastric outlet, indifferent. A newborn presents with bilious vomitings. This is newborn, bilious vomiting at birth. Fullness in the epigastric region, X-ray showed double bubble. This is significant picture of duodenal obstruction. One bubble is of duodenum, one bubble of the stomach. Within a few hours of being born, a baby presents with bilious vomiting. Abdominal distension, which one of the following? So again there is bilious vomiting, means it's not gastric outlet, history, gastritis, mucinum ileus, milk bowel obstruction. So it has to be mucinum ileus. All these other factors are. Mucinum ileus is typically present with cystic fibrosis. This is cystic fibrosis with the deficiency of pancreatic enzyme causing mucinum to be thick and viscous. and present within few hours of life, and absolute constipation. Bile state vomitings are there. Mucinium passes within 24 hours but fails. Abdominal exercise displays mottled appearance of lipid. It may be different husband disease. Okay. A 4-week baby presents with his mother with 3-day history of absolute constipation. Examination reveals the baby is of 4 weeks with the mother with a 3 days history of absolute constipation. Examination reveals diffuse tender absent bowel sounds, extra abdomen shows distended colon. Rectal biopsy is performed, demonstrate lack of ganglionic cells. This is typical feature of Hirschsprung disease. Aganglionosis, congenital defect. The specific thing in this is colon leading to constipation. Rectal biopsy is diagnostic. Genes involved in Hirschsprung disease is RET, chromosome 10, if you want to add any additional information, and so many other genes, chromosome 5, 10, all this. 23-year-old male is diagnosed with direct, age is 23, direct inguinal hernia. Surgical registrar intraoperatively ask you to define Hasselbalch's triangle. Hasselbalch's triangle found it medially by which of the anatomical structure? This is triangle. Lateral boundary is rectus abdominis. Medial is the inferior epigastric. Sorry, medially this is triangles on the side of rectum. So rectus abdominis is medially like this. Suppose this is umbilicus here, and this is pubic symphysis, and this is rectus like this, and there is rectus abdominis, and this is superficial inguinal ring. This is the deep ring. From here the iliac vessels, they travel like this, they form a triangle, and person is having direct hernia, means hernia is coming from this direction like this. So this is inferior epigastric is lateral, and this is medial, and below is the inguinal ligament. So next question, 45-year-old male obese, 45-year-old obese woman has open cholecystectomy several weeks after an episode of acute cholecystitis. During operation, surgeon correctly identifies the Calot's triangle located. Now Calot's triangle, this is clear-cut liver border, liver. So you see hepatic ducts are joining together to form common hepatic, and there is a cystic duct and the gallbladder and common bile duct, and artery crosses from here. This is hepatic artery and cystic artery. So this is common hepatic duct, this is cystic duct, and this is the base of liver. Which of the following anatomical structure form a Calot triangle? Cystic duct, liverage, left hepatic, no. Portal vein, liver, there is no involvement of portal vein. Common hepatic duct, cystic duct, and inferior border. And this is the right answer. Right hepatic artery is not there, this is all that. Question number 130, 42-year-old woman undergoes right total mastectomy with axillary node clearance for breast cancer. 42 years, mastectomy, axillary clearance. 2 days post-operatively, it was noted that she has winging of the scapula. This is typical loss of serratus, serratus anterior muscle, long thoracic nerve. A 22-year-old male presents to emergency department with right-sided direct inguinal hernia. Past medical history includes an emergency appendectomy. So, iatrogenic injury at the time of appendectomy was thought to be caused by subsequent hernia, and following structures are likely to have been damaged. So, it's damage to ilioinguinal nerve leads to. 25-year-old female was involved in road traffic accident and suffered a significant head injury. She has been monitored neurological. Blood pressure is 100/70 and heart rate is 80 beats per minute. Her current intracranial pressure is So BP is 100. Now what is we finding cerebral perfusion? CPP is equal to mean arterial pressure minus intracranial pressure, and mean arterial pressure is always systolic blood pressure plus 2 into diastolic blood pressure divided by 3. Here systolic pressure is 100, 2 is to diastolic is 140 divided by 3, 240 divided by 3, so it is 80 is the mean arterial pressure, and of our current intracranial pressure is 10, so perfusion pressure has to be 70. So this is the calculation. So next question is, a 52-year-old patient with known chronic obstructive pulmonary COPD, what is there? Person is known COPD and type of diabetes, was admitted to ICU after having an So the next question is, 9-year-old boy was referred to orthopedic patient with 6-week history of leg pain. The boy is 9-year-old, 6-week history of leg pain. X-ray revealed large mass in the femur. Bone biopsy performance revealed small round blue cells. Which of the following is most likely diagnosis? The age is important. History is 6 week and there is pain in the leg. So in children, you see Ewing sarcoma is most common primary bone tumor. It typically affects the diaphysis. So where is the bone biopsy is performed, reveal small blue cells. Which of the following? So children, Ewing sarcoma is common, metaphysis, epiphysis and diaphysis. So these are the three parts. Metaphysis is the central, epiphysis is the growth plate, and diaphysis is the ends. So it typically affects diaphysis of longer tubular bones, particularly the femur. Microscopic examination of the tumor reveals round blue cells of unknown origin. This is a feature, blue cells, round, is for Ewing's. Myeloma, the rest of the things, patient typically present with enlarging mass. So on X-ray, you get onion peel appearance also in this. Osteosarcoma histology reveals malignant osteoblast producing osteocytes and few aggressive tumors, with 20% having pulmonary metastasis. So pulmonary mets also common. So what are the other things? Myeloma is most common primary tumor, but typically affects patient above 50 years of age. This is above 50, myeloma. Malignant fibrous histiocytoma on histology consists of, this contains spindle cells. Malignant fibrous histiocytoma. Fibrous, just try to remember this word, fibrous histiocytoma. That is spindle cells and giant cells. Chondroma and osteosarcoma is not, Ewing sarcoma is second most primary tumor, typically affects. Next question, number 175. A 60-year-old male is scheduled to have total gastrectomy for Zollinger-Ellison syndrome, ZE syndrome. This is basically gastrinoma. He has informed preoperatively that he will require lifelong intramuscular injections of vitamin B12. Absence of which cells type is responsible for B12 requirement? So vitamin B12, and this patient is going to get, stomach is going to be removed, that is total gastrectomy. And now this, what is required? These are the cells which have specific function. Most of the cells, all are G cells, chief cells, parietal cells, mucous cells, goblet cells are in stomach. They are removed means the person is not going to have these cells. Then vitamin B12, for the absorption of vitamin B12, it requires parietal cells which produces the intrinsic factor IF, intrinsic factor, that binds to B12 in stomach, thereby facilitating absorption in the lumen. A person is eating, vitamin B12 is present in non-vegetarian diet. A person is eating, it is absorbed from the stomach with the help of intrinsic factor, which is secreted from parietal cells. So if parietal cells are absent, it not absorb anywhere else. So post patient require replacement because of absence of stomach. The G cells are found in antral mucosa. G cells in antrum, and they secrete gastrin. G cells are found in antral mucosa and also in small bowel. They secrete gastrin, which stimulates secretion of acid by parietal cells. So gastrin is required for secretion. G cells secrete gastrin that helps to secrete HCl. Okay. The goblet cells are found in bowel, not in the stomach. Basically, goblets, these are the bowel, large bowel, small bowel, something. Chief cells secrete pepsidogen. Pepsi cola. C is for chief, pepsidogen. And mucus cells secrete mucus. So next question is about it's question number 177. I think 176, yeah. 176. A 42-year-old woman has been diagnosed with thyroid. A woman is having thyroid cancer, woman. So biopsy demonstrate orphan Annie. Now the typical features of papillary thyroid carcinoma. There are certain features which you need to remember. Histology may defeat orphan Annie, PSA, Samoma, bodies, calcification, nuclear inclusions. These are the most of the nucleus features they when described as papillary. If the question is having lymphatic enlargement, that is papillary. For follicular, it has to be hematogenous spread. For other medullary, you have to see anaplastic, it is aggressive. So next question is 177. Question number 177. A 37-year-old male was admitted with perforated duodenal ulcer. At laparotomy, he was found to have perforation posterior part of the first part of the duodenum. Which of the following anatomical structures? So, a duodenal ulcer posteriorly when gets perforated, this is not pylorus. Just try to understand. What is their first part of the duodenum? This is stomach, pylorus, and duodenum first part. This is second part, this is third part. So pylorus and there is a vessel behind. So that is gastroduodenal. Posteriorly there is gastroduodenal artery, which is common to bleed. A 37-year-old woman fell from the roof of a house. Paramedics on arrival report that she is opening her eyes to speech, moves in response to painful stimuli, withdrawing her arms and using inappropriate words. So this question has to be immediately solved in this manner. What is there? One is eye opening, then motor and EMV, verbal. So eye opening, there are 1, 2, 3, 4. Motor 1, 2, 3, 4, 5 and 6. And verbal is 1, 2, 3, 4, 5. Total is 4. So person is spontaneously opening, or how is the person opening the eye? She opens her eyes to speech. Spontaneous is 1, speech is 2, so this is 2. Painful, you have to go from, sorry, spontaneous is, it's in the other way. I'm just going in this. 4 is a good score. Spontaneous. 2, speech. Painful, no response. So verbal, so here the person is, she is opening her eyes to speech, is 3. Now how is the motor? No response, extension, flexion, withdrawal, localizing, and moving all extremities. So verbal command, no response. Then appropriate, inappropriate, APPROP, 3 words, 3 P's are there. This is confused and responding normal, and this is grunts and sounds. So confuse, F is there, take it as 4. Inappropriate word is there, 3. Only sounds, 2. Here she is opening to speech. One we have done, one thing is, this is speech is 3. Then second is moves response to painful stimuli. Moves in response to painful. Moves in response to by withdrawal of the withdrawal. Again withdrawal. It's not flexion. He is withdrawing. Localizing is different, and using inappropriate words is 3. Inappropriate words. So this is coming at 3 plus 4 plus 3. So with this calculation it comes to be 10. So this is way you have to calculate it fast within 1 minute. So commonly asked questions are, they never ask he is spontaneously opening. To pain and the speech, among the 2 is there. If you are talking and opening, yes, come on, open the eyes, you look at me. If he is opening, it is 3. If you are pinching and person is opening, means 2. Pinch, 2. Speech, 3. This you have to keep in mind. First thing is over, it's easy, it's among the 4. This is never come asked, this is never asked, only middle 2 is there. You have to think of 2 or 3 only. Speech 3, pain 2. Then second part is motor. EMV or EVM, let it be. Start from extension is the bad position, that is decerebrate type. So no response is 1. Then little bit is when you are pinching, the person is extending, you are pinching when flexing. So you have to just think, extension word is there, it is less than lowest, 2. Flexion 3. Withdrawal means again little bit up. Localizing with the other hand, trying to push with the other hand is 4. So anything can be there. 2, 3, 4, 5. So you have to go this step up. Means extension very bad. Flexion 3. So in flexion, F is there. F, you just think of 3. E is there. You think of 2, extension 2E 3F. Okay, the way we think of speech 3. So this way while calculating we get confused, and just single, so you see answer has got 10 as well as 9. If you miss a single option, you are losing the mark. This is so tougher. Then verbal response, there will be no question on the no response. Grunts, there will be so many questions on grunts, sounds. So nothing specific about the words. Grunts and sounds means 2. Inappropriate and confused, I just try to find out the alphabet in this, which can immediately give you an idea whether it is 3 or 4. Confused, this word is commonly used. Confused, see, a person is confused. F is there, 4. Inappropriate, it has got 3 P's, A, P, P. So 3 P's, 3. This is the way I have tried to find. If you lucky to get these words in the question, if anyone is lucky, you will get able to answer. Inappropriate, otherwise they may have some other word and you may get confused. There is you yourself may get confused. Okay, next question is, a patient is having emergency upper abdominal gas endoscopy, emergency UGI, upper endoscopy for bleeding ulcer. There is a gastric ulcer which is bleeding. Ulcer is found to be the lower greater curvature stomach. Which of the following artery supplies the? This is the stomach, greater curvature, lesser curvature. You have got here at this. So this side, yes, at this side there is ulcer. This has got left gastric, right gastroepiploic, left gastroepiploic. Just try to remember this. If the word is there at left gastro, right gastroepiploic, so the ulcer is found to be in lower greater curvature. Which of the following? So greater curvature is this, and here in the lower, so this is right gastroepiploic, this is left gastroepiploic. Left gastroepiploic word is there, but I can't find right gastroepiploic in this. That's why if right gastroepiploic, then we would have mentioned it, but here is only left gastroepiploic. So answer is left gastroepiploic. A 50-year-old male is undergoing total hip replacement. Now what you are doing? THR, total hip replacement, THR in 50 years. The operating surgeon takes a lateral incision approach to the joint, which anatomical. This is from the lateral side, does not attach to greater. There is nothing with the incision. This is not question about any injury or everything. Now, which of the following anatomical structure does not attach to greater trochanter? What is attached to greater trochanter? So gluteus medius, obturator. So there are things. Gluteus medius, obturator internus, piriformis, obturator externus. Most of the muscles which are attached are this. The only muscle which is arising from the iliac blade is attached to the lesser trochanter. Lesser trochanter is on the medial part of the proximal, and psoas and iliac is attached to it. The muscles flex the hip. Femoral greater trochanter is on the lateral part of the hip, and several muscles attach. What are the muscles which are attached on the lateral? It is gluteus medius, minimus. These are the major which are attached. Then obturator internus, piriformis, gemelli, all the muscles which are causing abduction. This is on the or external rotation may be attached. This so the internal rotation is with the okay. Next, coming to the next question, 181. A 24-year-old female. Just try to remember first what is the age and sex. This is a female, 25-year. Appendicitis. Now, the females have got confusing picture because along with the appendix, there can be uterine, there can be any ureteric. While awaiting her procedure, she is made kneel by mouth and put on intravenous fluid. First bag of fluid put up in 1 liter of normal saline. How much sodium is there in the bag? Sorry. So what's there? It's 1 liter normal saline. So how much sodium is there now? Saline is having sodium. So daily requirement of the adult fluid is 3 liters per day. For an average adult, if the individual is placed nil by mouth, this requirement is easily achieved by 3 bags of intravenous fluids. 3 bags of intravenous fluid each run over 8 hours. So 1 liter of saline contains 54 milliequivalents of sodium. So each bag is containing 1 liter. 154 milliequivalent. This is in 1 liter. The average adult requires 100 millimoles of sodium per day as equivalent as well as 60 millimoles of potassium. It is just 100 means 1.2 or 1 milliequivalent per kg. 1 millimoles potassium per kg, so 70 will require 70. Addition of 20 potassium each bag prescribed over the days. So it is 154. Normal saline contains 154. This is normal saline. It contains the same quantity of chloride. Next question is a part of a triple assessment. This is triple assessment in the breast. 55 years. Age is important. FNA. What is triple assessment? Clinical examination, biopsy or FNA, ultrasound or mammography. The cytology comes back as C3. Which one of the following best describes C3? Now this is very important. You have to understand what is C1, C2, C3. So C1 FNAC, sample in So what is there? C3. Now we were talking about C1, C2, C3. Let us finalize it, because the question comes, what is C1, C2, C3, C4, C5? There is insufficient sample. You need to repeat it. C2 is 100% benign. C3 a person is uncertain, can be or cannot be. C4 is suspected, and C5 is breast cancer. So C3 is uncertain. Insufficient is C1. Breast cancer is C5. Equivocal. So it is, answer is equivocal, means uncertain. This is C3. Suspected breast cancer is 4, and no breast cancer benign is 2. So 1 is need insufficient sample, 2 is benign, and 5th is cancer. So 2 and 5 and 1 is over. In between center is equivocal and suspected. Insufficient, benign clear cut, equivocal can go on this. This is going like this is in the center, and there are 2 and there are 2. So C is in the center, equivocal. It can go here or here, any direction. If it goes in this direction, it is towards benign. It goes in this direction, it is towards malignancy. So second will be suspected, and E is confirmed. Then here is benign first, and below that will be insufficient, non-diagnostic, means it is still patient may have anything. So equivocal is in the center. 48-year-old woman undergoes a triple assessment for left upper outer quadrant breast. Age is 48 year. Triple assessment, left upper outer quadrant. Results of the clinical assessment show lump of 4.5 centimeter in diameter. 4.5 centimeter. Left upper quadrant. The result of clinical assessment shows, this is clinical, the mobile lymph node on the same size. Lymph node is also plus. No distance metastasis. Now there is nothing but a diagnosis. They are suspecting it is a malignancy. What will be the stage? 2 to 5, mobile. So it is T1 is less than 2, T2. So this you have to remember. Again, what is T1? N1, N0, it's okay. Mobile is always N1. N2 is more than 1 with mobile lymph nodes. Okay, it is not adherent. So it is mobile. So let us first finish M0. It's out of question. So it has to be among these three. All this M0. Now N1. It's simple. It is N1 as it is mobile. And fixed lymph nodes, same side mobile lymph nodes is N1, same side fixed nodes is N2. Now what about T1, T2, T3, so and T4? Less than 2, 2 to 5, more than 5, either skin or deep to the muscles, chest wall or skin. So this is mobile, that's why it is not T4. Even if it is 2 centimeter and it is any adherent to any of this, it can go in T4. So this size is 4.5, clear cut mention. It is coming in 2. So it is T2 N1 M0. Next question is 38-year-old female presents to your ENT clinic complaining of 1 month history of repeated attacks of vertigo, which are particularly severe when she turns over in bed. When she turns over in the bed, you conduct Hallpike positional maneuver, which is positive. Which of the following is most likely cause? So for this, the thing you have to understand is vertigo that are short-lived, usually lasting for a few seconds, are provoked by turning of the head. The benign paroxysmal positional vertigo, these are benign position, occurs spontaneously. In the case of chronic otitis media or secondary to head trauma, the Dix-Hallpike positional maneuver reproduces the symptoms achieved by rapidly turning head when it is positioned and held below the horizontal plane of the body on examination couch. Treatment is by Epley's maneuver. Meningitis disease is tried of vertigo. So here it is benign positional vertigo. A person is getting severe vertigo when he is trying to keep his head down at the horizontal level. Fundus of the stomach is supplied by which of the following arteries? This is anatomy. You have to study the arteries: celiac, hepatic, from here left gastric, right gastric, maybe gastroduodenal, gastroepiploic, left gastroepiploic. Some of there is splenic arteries going like this, and they are supplying to fundus of the stomach. Short gastric artery. Splenic artery runs. So what is the question? Short gastric artery. It is supplying from the splenic artery. The pterion is a meeting of squamous temporal, greater wing, frontal, and which of the parietal. They ask the easy thing, because confusing part may be temporal bone, it's squamous part, sphenoid bone is greater wing. So sphenoid bone, lesser wing is never there. Temporal bone, petrous bone part is never there. This is lesser wing. Zygomatic is not there. Nasal, lacrimal, it is parietal. Which one of the following pigment is associated with aging? Everyone has to go into this. Some may go earlier, some may take time. So this is which one of the following pigment is associated with aging. It's very interesting. Lipofuscin is a brown pigment that accumulates in aging. It's mainly formed from old cellular membrane that have come cross-linked as a result of free radical damage and accumulate in residual bodies. without being metabolized. It is referred to as aging pigment, that is eosine. This is an aging, AGE. So just try to remember E is an aging, end of the age, whatever pigment you see is aging. Amyloid, melanin, lipofuscin, no, lipofuscin. Brown pigment accumulates in aging cells. Lipofuscin is a brown pigment that accumulates in aging cells. It mainly formed old cellular membrane have become cross-linked as a result of free radical damage, which accumulate in the cell body without being metabolized. It is also referred. The answer is lipofuscin, but explanation they are giving is lipofuscin. But the answer, we will just keep it like this. In an explanation, they are talking about lipofuscin, but the answer they mentioned is eosine. I will keep it star mark to revise and check it. Which one of the following is not a chemical mediator of inflammation? So this question again, what are the mediators? Histamine, we know, prostaglandin, interleukin 5, telomerase. What is telomerase? Histamine is from the mast cells. It causes vasodilatation. Prostaglandins are derived from arachidonic acid. And chemokine selectively attracts various types of leukocyte inflammation. So interleukins and all this. The enzyme telomerase allows replacement of short of DNA telomere which otherwise shortened. So this is an enzyme, DNA telomerase and all that. It is not a part of inflammation. Gas gangrene is most commonly caused by which of the following organisms? So it's simple, straightforward. Clostridium perfringens, gas gangrene, Clostridium tetani. So gas is spreading tissue necrosis, spores, Clostridium intravenous, out necrotic. So rest of the things, staphylococcus, skin infection, pyogenesis, Clostridium tetani, tetanus, and Mycobacterium tuberculosis. Which one of the following is a type of apoptosis? Now this is apoptosis, means total cell is, it has to be so the next question is, which type of the following is apoptosis? We were on this. So apoptosis is a type of individual cell death associated with growth and morphogenesis. It can be triggered by the factor outside the cell or can be autonomous cell program death. In embryological development, there are 3 categories of autonomous apoptosis. So during development, some of the cells may get apoptosed. These are morphogenetic, histogenetic, phylogenetic. Morphogenetic apoptosis occurs during embryological development involved in alteration of tissue form. For example, interdigital cell death. So you have got a hand, fingers are there, which are initially fused. These interdigital cells, they have to die. That is morphogenetic. Cell death responsible for separating the fingers. The fingers will be separated. That is so important. If that may lead to failure of the fusion, may lead to syndactyly. So that is called as one type, morphogenetic. Cleft palate, spina bifida. Failure of various leads to pathological stage. Histogenetic apoptosis occurs in differentiation of tissues and organs such as hormonally controlled differentiation of accessory productive structures, Mullerian-Wolfen ducts. So this is histogenetic. Phylogenetic apoptosis involves removal of vestigial structures from the embryo such as pronephros. So remnant of such may lead to, so this among this histoplasmic is not there, cytotoxic not there, hypertrophic not. morphogenetic. So there are three types. Morpho, example was syntactically, then histocellular, histogenetic, and third one is phylogenetic. So example of histogenetic where Mullerian duct, Wolffian duct, where the sexual reproductive structures are microscopically changed, that is histogenetic. And phylogenetic is responsible for vestigial structures, pronephros, the renal system, ureteric system, bladder, and all that. In this pronephros gets apoptosed, so that is phylogenetic. Vestigial structure. It is a vestigial structure. Metaplasia is reversible Now coming to next question, what is metaplasia? Is reversible transformation of one type of terminally differentiated cell to another fully differentiated cell. This is actually the answer. Terminally, one type of terminally differential to another. It is differentiation of one cell to other. Metaplasia is reversible. Metaplasia occurs as a tissue response to environmental stress. This causes a reversible transformation one of the terminally differential to another. For example, glandular metaplasia of lower esophagus. Barrett's esophagus is a classical example. A change from non-keratizing squamous epithelium into glandular epithelium. Once the stress factor is removed, this may turn back to original. Hematomous polyps in GIT. Are associated with hematoma is always, most of the time, hematomous polyps in pediatric associated with pure sugar syndrome, PJ. Hereditary intestinal polyposis syndrome. Hereditary intestinal polyposis syndrome. Autosomal dominant. Benign hematomous polyps, GIT, and hyperpigmented macules and lips and mucosa, pure checker. All of the following neoplasms are dependent on growth hormone except all of the following neoplasms, means new growths, are dependent on the growth hormone. So thyroid carcinoma, endometrial carcinoma, prostate carcinoma, breast carcinoma are dependent on growth hormones except this is the bony osteosarcoma. In these thyroid cancers, papillary follicular carcinomas respond to growth promoting effects of TSH. Estrogens are associated with breast and endometrial. So it is not the growth hormone, it is something which is related with the stimulating hormone, TSH, LH, luteinizing, estrogens, luteinizing or estrogen. They stimulate endometrial carcinoma, thyroid carcinoma, estrogen, breast carcinoma, prostate with the androgens. So these are supposed to be called as TSH, and they are, in that sense, it is supposed to be called as growth hormones. Prostatic epithelium carcinoma dependent on. So except osteosarcoma. Which one of the following does not contribute to innate immunity? There are two types of immunity, innate and humoral. Innate is just the cell surfaces, physical barriers, mucosal epithelium, secretions, antibacterial, lactoferrin, soluble materials, CRP, mannose binding lectin helps to enhance the activity of innate and specific response to antigen. So among this, calcitonin is a hormone, it is not an immunity. This mind, lectin, lactoferrin, mucosal epithelium, C-reactive, all these are innate immunity. Which one of the following immunoglobulin is first to be produced by beta lymphocytes? Now, I am first. Just try to remember, you go. M is first. Which one of the following is first to produce beta lymphocyte primary encounter with the antigen? B lymphocyte initially produce IgM antibodies after encounter with the antigen, as is effective in complement. IgM has short half-life. Subsequently, beta cells undergoing class switching. So there are some doubts in this. In the explanations, they are giving about one, while answers they are writing something else. So coming to next question, 196. Hemoglobin A deficiency associated with which of the conditions? So what is the functions? This you have to understand. A is basically A. If you see the mnemonic is GAMED. A is basically for the surfaces, mucosal. Then rest of the things, GM is a very short life. It's for the complement fixation, opsonization. E is anaphylaxis, allergies. D is with some hypersensitivity and all that. IgG is coming next. Patient with respiratory infections encapsulated and produce IgG. So if there is deficiency of A, that may lead to infections of the mucosa. Patients with primary antibody deficiency. Now coming to 197, we will finish 200 questions. Patients with primary antibody deficiency are predisposed to be one of the following. Antibody deficiency, any of the antibodies which can fight. So osteoporosis, salmonella osteomyelitis, mycoplasma arthritis. It is arthritis, mycoplasma. Primary antibody deficiency, it is also called as PAD, PAD. Syndromes are disorders of B cell development function with impaired or absent antibody production, represent with pneumonia, sinus, gastrointestinal infection because of absence of hemoglobin G, mucosal hemoglobin A, PAD, patients with low levels of IgG such as mycoplasma. It results in joint destruction, chronic pain. So mycoplasma arthritis, that is the main. Virus-laden cells are specifically killed by which of the following? So it's killer cells, killed. Question is killed. So directly go for the killer cells. This is innate immunity. No T cell everything required. May be seen histology in which of the malignancy. Just now we have talked about papillary cancer. Which of the following is an example of malignant tumor of the skeletal muscle? Mesenchymal. So it is malignant. It is rhabdomyosarcoma. Leiomyosarcoma is fat. This is bone. This is again benign fat. This is glandular. So here we stop at question number. First section is over. Then we will go for the next questions. Next section, 200 questions.